So welcome everyone to Spectrum's Personality Disorder and Complex Trauma Echo. My name is Dimi, Head of Workforce Development, and the Workforce Development team, including Lived here today, coordinate these echo sessions. Firstly, I'd like to acknowledge the traditional custodians of the land on which we meet today, pay our respects to elders past, present and emerging, and acknowledge any First Australians who may be present. We also acknowledge people with lived and living experience of mental ill health and recovery, and the people and experience of those who support them, including carers and families. The voices of people with lived and living experience inform our work. And finally, but not least, I welcome Andrew Mottram from Spectrum. He'll present on antisocial personality disorder through a mentalizing lens. Andrew is a senior clinical psychologist and accredited mentalization-based treatment practitioner and supervisor. He holds broad experience in working with complex and severe personality disorder across several therapeutic modalities, including ACT, DBT, and now focusing solely on MBT since 2016. His work with Spectrum includes complex care service consultation and treatment, as well as delivery of MBT to both groups and individuals. Andrew is passionate about this treatment approach and the value it holds for both consumers and clinicians. So welcome, Andrew, over to you. You can share your slides.
Thanks, Timmy. All right, I'll just get started. It's great to be coming along and speaking a little bit about antisocial personality disorder through the mentalizing lens today. So I'll just start by sharing my slides. All right. I think that's perhaps appearing in a window. That's, I think, as good as we're going to get at the moment. But look, where I might begin today is to acknowledge that at Spectrum, the vast majority of the people that we work with present with borderline personality disorder, and so my understanding of antisocial PD and of MBT, of course, is there, but my direct experience of working with antisocial personality disorder is a gap in my experience compared to perhaps those of you who work particularly in the forensic system. However, lots of the principles I'll be talking about are very applicable to ASPD. MBT was, of course, developed by Anthony Bateman and Peter Fonagy in the UK. And Anthony's been running effective group treatment for people with antisocial personality disorder for quite a number of years and has written extensively about it. So he's been able to produce some good results with this model. What we'll be talking about today is mostly about how to formulate antisocial personality disorder through the MBT framework rather than the treatment, although we'll get to treatment at the very end and hopefully hear from Anthony directly if I can get the video to work okay. But look, just to go over some of the basics for those of you who perhaps don't work with antisocial personality disorder, well, what defines it? Well, what we see in ASPD are failures to kind of work within regular social norms of lawful behaviours in society. And that's a pervasive sort of presentation, a pervasive sort of element to a person's operation in the world. Frequent sort of deceitfulness, often things like impulsivity and failure to plan ahead, frequent irritability and aggressiveness, often an impulsive disregard for safety of self and others, pervasive irresponsibility and a lack of remorse. Overall, ASPD can be characterized by a failure to manifest any kind of prosocial behavior and work collaboratively with others in society. That brings people into regular conflict with society and conflict with the law and with others. As well as conflict in their relationships as well, that their relationships are often very distrustful, problematic, and tense, kind of fraught landscapes. And naturally, these features are not very endearing to others in society either, people who come across individuals with ASPD. People with ASPD are often experienced as quite self-serving in terms of their attitude to the world, and their unpredictability makes others very wary of them. What we see also is that there's a large overlap in symptoms between BPD, antisocial personality disorder, and narcissistic personality functioning. So things like irritability and aggressiveness are often present in narcissistic personality structures, borderline personality disorder, of course, impulsivity around safety of self and others, lack of remorse, and so on. And I think that's a good reminder of the direction that we're all heading in around personality disorder diagnosis, moving towards less of a categorical model and more of a continuum model where lots of these personality characteristics turn up and overlap. You may have attended previous Project Echo sessions or our training around MBT and mentalizing, but just to go over the basics here, what is mentalizing? Well, it's the way that we sort of understand and link behavior and appearance to things that are happening on the inside of us. So it's the way that our minds tell us what we're feeling and thinking and why we're behaving the way that we are. And it's also how our minds tell us what someone else is feeling and thinking and why they might be behaving the way that they are. And it's a skill that may seem sort of straightforward and natural, but it's also a skill that isn't always well developed in people. And, I think it's very common for anyone to have challenges with mentalizing in various contexts. Important to note that mentalizing helps us to identify what's going on the inside and understand our inner selves. So name our emotions or recognize what's happening inside, as well as sort of have a kind of coherent model for why we do what we do. Mentalizing also helps us to separate ourselves out from others and have a clear sense of self and a boundaried sense of self, rather than getting into trouble with things like fusion of the self or emotional contagion and experiences like that. Mentalizing is important for a lot of reasons, but as mentioned a moment ago, being able to understand what we're feeling and the context for that, so why we're feeling those feelings, helps us to begin to regulate our emotions more effectively, rather than resorting to needing to get rid of our feelings in some way by acting out. Mentalizing in relationships helps us to foster a sense of safety and security in our attachments. It helps us to build connections with others and empathize with others, share experiences, be vulnerable with others. It helps us to communicate and understand each other, others as well, and express our needs and desires and meet our goals in relationships, and also work collaboratively and grow socially with others. Mentalizing helps us to slow down and pause and reflect rather than reacting. Helps us to step back and begin to see things from alternative perspectives or even multiple perspectives at the same time. And we need to be able to mentalize in order to benefit from the social world around us. So when we come across new information, external sources of information, like people around us, we need to be able to have a sort of openness to those perspectives in order to learn from them and update our own understanding of the world, understanding of ourselves and our schemas for how we operate in the world. We develop our mentalizing ability through our early attachment relationships. and it fluctuates. Mentalizing is a skill that fluctuates based on our stress levels. When we're stressed enough, whether that's sort of cognitively by being overworked, overtaxed, or affected by substances or things like that, or when we're emotionally activated and emotionally stressed, given enough load, our mentalizing capacity can collapse. And that's when we tend to act without thinking, and things kind of just happen. We hear clients say, I just went from 0 to 100. I don't know what happened. Suddenly I was standing over him and he was on the ground bleeding. And MBT puts mentalizing both at the core of most psychiatric illness and also at the core of effective treatments as well, and proposes that all effective treatments for psychotherapeutic treatments, I should say, work by increasing the ability to mentalize. Now, we know for people with personality disorders, if we're thinking about antisocial personality disorder, that mentalizing is very difficult. And that's because the attachment system, which is there to promote survival, is easily activated, particularly in interpersonal contexts. And people very quickly lapse into fight or flight mode. So they're prone to feeling that emotional stress or that cognitive stress very easily, and they're prone to reacting usually in violent ways. So people with antisocial personality disorder are kind of stuck in a survival mode in a very hostile world, and they tend to manage that survival through threats and violence. They also have great difficulty in trusting anyone else, and so they've formed views of the world and of themselves, usually very early on, that are rigid, and they're unable to learn from those new sources of information that don't confirm their existing views of the world. And so they tend to be stuck in this pattern. When they enter treatment with us or the justice system and come across clinicians or authorities, lawmakers and so on, that encourage them to think about the world differently or to stop using violence and things like that, those sources of information are just simply disregarded. That information isn't seen as personally relevant. And so people with ASPD will say, well, look, you just don't get what it's like out there for me. You're telling me that I need to cease being violent. That's absolutely not possible. You just don't understand. In MBT, we look at this dimensional model of mentalizing. So, when we're thinking about formulating a client, we'll tend to map them out on these 4 dimensions. Broadly, most of us are using automatic mentalizing most of the time, and that's even more acute in people with personality disorders. So mentalizing is happening very rapidly without a lot of conscious control, and a lot of assumptions are being made about interactions, about the self, or about others. I won't go into detail about the other dimensions here. You've got them there on your screen, but what I might do is move forward into discussing what this means for people with antisocial personality disorder in particular. Well, we know that people with an antisocial personality disorder tend to have very fixed views about themselves. They tend to perceive themselves as misunderstood and ill-treated. And they tend to compensate for that by having a kind of an inflated sense of self, a grandiose self, and they tend to use that to compensate for that very fragile kind of ego. Of course, we tend to experience people like that as narcissistic, and they tend to experience other people as quite frightening in a way, although that's probably not a very conscious thing a lot of the time. But they spend a lot of their time trying to deactivate their attachment system. They tend to fear fusing with others or being controlled by others or vulnerable to others, and so they tend to deactivate their attachment system in relationships and push others away or hold others away. Even in their intimate relationships, say with a partner or a child, in sort of parental sort of mode, then they still may compensate for that fear that they have through deactivating the affective side of things and being more cognitive, controlling, things like that. People with ASPD tend to see relationships as very hierarchical. They divide the world into people who are at the bottom, who are being bullied and subservient and so on, versus being dominant and controlling and on top. A good example of this is the structure of a gang. In people with ASPD that fall into gangs, people tend to know their place in that hierarchy. It's sort of a very structured, predictable and social world. And within that, we know that people with ASPD are very kind of susceptible to and hypersensitive to any loss of status, any sense of disrespect. It is particularly devastating for them. That can activate that fragile inner self, and that sense of shame in particular is something that they're often trying to avoid and control. And a good way of doing that for people with ASPD is to do that through physical force, by removing that threat immediately. They tend to have less interest in other people's mental states. They tend to devalue others. They tend to see others as stabilizing their sense of themselves within the world, particularly the establishment, and so on. I won't go over this too much. I think I've sort of made these points already, that people with ASPD avoid their internal affective states, and they tend not to pay much attention to other people's affective states either, except in cases where they're able to utilize other people's emotions in order to control them. So they may go as far as sort of triggering emotional experiences in other people to their own ends. People with ASPD tend to apply a psychic equivalence, a kind of mode that emerges when our mentalizing is very poor, and tend to sort of form a view of the world or a situation, and then that becomes the reality of what's going on. And they're also quite prone to a kind of pretend mode suspension of mentalizing, a blindness to the consequences of their actions, say through violence and so on. So, in order to engage in violence towards others, we need to be able to remove our sense of their humanity, and we don't want to empathize with the victim of our violence. And so we might suspend that by just not thinking about it at all, not thinking about that person's safety, our safety either, the consequences of our actions. Look, as I've mentioned already, these threats that people feel to their stability of their self-esteem and identity, and any kind of activation of shame, tend to be managed by controlling other people, and often through violent means. And that, in MBT, we kind of look at this as a teleological mode of operating in the world. That people with ASPD will focus on understanding other people through their external appearance, through their behavior, rather than thinking about their internal states. And of course, will exact changes in the world through physical means as well. So they may not be interested in resolving a situation through any kind of discourse or change or reflection on or meeting of minds, but really through just kind of perhaps beating someone to a pulp. Look, I'll show a video in a second of Anthony talking about MBT treatment, but look, in general, if you're familiar with MBT for BPD, as we've presented here in the past, it's not that different from the established principles that MBT follows in treating BPD. In particular, though, for working with ASPD, there's a great deal of emphasis on the initial formulation and on identifying the person's relational patterns and what might emerge in treatment as well. And then that's looked for. But I might pause here for now and let Anthony say a little better than myself, if that's all right. I'll just stop sharing here. And let's see.
Well, that's a great question, because when you first see them, they have no interest in thinking differently whatsoever. So the first task is always to actually try to engender a process whereby you're solely taking their mind states into account. You're simply exploring their views, their values, their perspective on what's happened to them, what is happening to them, their perspective on their current relationship, however they perceive it, and to take that absolutely seriously, face value, and explore it in a lot of detail and depth. And until they have a sense that you see things from their perspective, you can't do anything else at all. Once you've done that, you then subtly or gently move away to actually push them to consider others' mental states in various ways, or in fact others' emotional states very often, because they're not very good at seeing other people's emotions, or at least responding to them in a feedback system. So for example, if they see someone else is a little scared, they don't care. When actually people without antisocial personality disorder, if they see someone they're making anxious or scared, they tend to get a feedback system which alters their behavior. So we spend a lot of time getting them to consider these sort of feedback loops, particularly about others' emotional states. And we do that now primarily in groups. And the reason for that is, of course, is that peer pressure in antisocial personality disorder, gangs, for example, actually can function incredibly well. They're very good at gangs. They organise them, they have a proper hierarchy, they understand each other's roles, they know how someone's going to respond, and so on. So we simply set up a gang, in a sense, except it's called a therapeutic group. And then we get them to start considering each other about what they're doing, what they're like, how they see each other, and so on. The low-hanging fruit that you see early on is actually their recognition of other people's emotional states. When they start in the group, they have no interest in looking at others, particularly trying to read what their mental state might be from how they're presenting or how they're expressing something. And we focus a lot on that early. And actually, they begin to realize it's incredibly informative. That if you bother to look at people, if you bother to think, say, what's behind that smile, what are you laughing at, in a genuine curiosity, they actually begin to work out that this is quite useful, actually. They may then, of course, try and misuse it later, you never know, but nevertheless, they're very quick at picking up, actually, you can ask people things, you can check things out, you can understand what people's emotions are a little bit, rather than just seeing them as a threat or something like that.
All right. I might pause things there, mindful of the time, but